With the average consumption of refined sugar being anywhere between 61 to 151 pounds of sugar on a yearly basis consumed by Americans, I thought it was bittersweet enough to start digging into some health conditions that are linked to this refined sugar. Now, it's a problem because it's in many processed foods, and there's about over 55 different names for sugar. The labels may not just say sugar, they may say dextrose or fructose or glucose or malt or agave and honey and invert sugar or coconut sugar. And you may think that you are eating a healthier version of sugar. So let's break down what exactly is going on. We'll talk about the inside as well as the outside because sugar affects both parts of us, inside and external factors. So we all know that sugar does raise our blood glucose levels. And what does that do? Well, it gives us a boost of energy. When we drop the sugar levels, we get fatigued and mood swings and headaches. And what happens is it creates this vicious cycle where we then want the very thing that caused this spike in sugar and energy, but it leads to addictive behavior because the same part of the brain that's affected by cocaine and alcohol is affected by sugar. So you really want to look at your mood, your behavior, if you are consuming too much sugar. Now, sugar does raise the risk of obesity and cardio issues, as well as certain forms of cancer. But did you know that adolescent obesity tripled in 30 years? And childhood obesity doubled. So the numbers are telling us there is a problem. Perhaps we need to go back to homemade cooking where it is single foods. For instance, if you make chicken, that's single food. A sweet potato, single food. It's the minute we look at processed foods, we really have to read our labels to determine if we are getting hidden sources of sugar, because that's what's going to add up, and that's what's causing childhood and adolescent as well as adult obesity, heart disease, diabetes. Sugar promotes belly fat, and that belly fat is linked to cardio issues. Now, there have been studies that show there are negative survival rates for breast cancer and colon cancer when they are having excessive sugar. I would recommend anyone who has cancer to have a low sugar intake on a daily basis. It does make a difference. Excessive sugar is linked to liver and kidney damage. And the tricky thing about this is you don't even have to be overweight for this to be happening to your liver and your kidneys, because the high sugar intake affects the fat buildup in the liver, and the kidneys are going to work overtime to filter out all of this sugar that's coming into the blood system. So it's really important to understand that, yes, we understand it's linked with obesity, but you don't even have to be overweight or have a high BMI number for the sugar to negatively be impacting your liver or your kidney health. And that's a problem because that will cause systematic inflammation. So inflammation throughout the body, which then causes arthritis, joint pain, dermatitis. It could cause uveitis, anything that's related to inflammation. And we know that the root of all illness we look at, we see inflammatory markers. Now, why is sugar intake so important at this time of year? Cold, flu season, COVID, because sugar impacts negatively our immune system. And bacteria and yeast feed off of sugar, and that also causes inflammation. And then it suppresses our immune system, so we can't fight off the colds and flus and viruses that we need to. And what was very common throughout was the majority of COVID symptoms, and patients who had the most symptoms had pre-existing conditions like diabetes, or they were overweight, or they had cardio issues, something with their blood as well. So you really want to keep a food journal throughout your health journey to determine if you are consuming too much sugar. Sugar also promotes a chromium deficiency. 90% of Americans are chromium deficient, and that is needed to regulate our blood sugar. You see, it's all connected, what this little white refined sugar is doing. And not even white, even brown sugar, corn solid syrups, so many other names for sugar that are causing all of these problems. Now, if we look on the outside, we do see that excessive sugar is linked to dermatitis, acne, as well as premature aging, because it causes your skin to sag. It also affects our neurons that are linked to memory and cognition. So for dementia and Alzheimer's, you always want to look at diet as well. Look, you always want to look at diet all the time, because the core of your health starts in your stomach, what you put in it, and how your health of your GI tract is as well important. So your food can either affect the beneficial bacteria, or making it positive and adding to it, or take away from it and possibly adding to candida and inflammation and all these other things. Now, most people know that sugar causes tooth decay because it is the #1 food substance that causes the decay on the teeth and can be linked to gum disease, and gum disease could be linked to cardio health. So it's very important to see this cascading effect. Now we talk about mental health and stress. And boy, people are under stress these days for a multitude of reasons. Sugar negatively impacts your body and increases stress because of the hormones that it can release, like cortisol, which you need for a fight or flight mode. You get this certain burst of energy to deal with the stress. But if you are chronically under stress, and you know that sugar increases it, this is why you want to keep that food journal, and you want to look at what you're taking into your body. Sugar affects stress, and it keeps your body in that chronic stress mode, chronic flight or fight, and that leads to adrenal burnout and adrenal fatigue. So that's a problem as well. Furthermore, sugar will take the place of essential nutrients. This is why I'm a fan of an organic acid test, functional medicine, first morning non-invasive urine test, so you can see your nutritional markers. And you want to look at your vitamin B12, your vitamin C, your folate, your calcium, as well as magnesium, phosphorus, iron, and vitamin A. So many different things to look at. Make the decision if you are consuming too much sugar. Read your labels. I will post the 55 plus different names for sugar, so you can print that out and look at perhaps you are getting too much of it from any processed food. I'm a big fan of organic whole leaf stevia extract. It does not raise your blood glucose level. You don't need to use a lot. And if you have a sweet tooth, this may be a way for you to get off the regular sugar. And remember, if it's not organic, it is highly loaded with glyphosate. So if you are consuming processed foods that have sugar and it's loaded with glyphosate, that is hurting your beneficial bacteria as well as leaving you vulnerable for degenerative diseases, and it does also affect anxiety and depression. So go back to your food journal, track what you're eating, track your mood, track your energy level, your sleep, and make the conscious effort, be mindful to reduce your sugar levels, trying to keep it to 21 grams of sugar a day. The American Heart Health Association, I think, says about 35. I always strive for 21, since sugar is linked to so many degenerative diseases and don't need sugar to sweeten up your life. Hope this empowered you to become your best health advocate. You're here for a reason. You have goals and aspirations, and you know what? You have to feel your best. Total wellness of mind and body to achieve them all. Remember, your health is worth it because you are worth it. Bye now.